Hi, tonight our special focus is vaccine hesitancy. COVID-19 has ushered in many changes in our lives and also many new debates. So let's look at some of them. Should countries impose restrictions on people without a vaccine passport? Can restaurants, entertainment venues deny entry to people who have not been vaccinated? And can employers make vaccination mandatory in the workplace? The Human Rights Commission suggests that people should be able to refuse. Now, in June, the government gazetted a new directive on COVID-19 vaccination, which stipulates that employers are required to come up with reasonable resolutions so that all parties are accommodated should employees refuse vaccinations. Let's find out exactly where we are. To discuss, we're joined by Natasha Moni, who is a director at Moni Attorneys Incorporated. Thank you for being with us. Natasha, do you agree that given the government's latest directives, I think those are the latest, there should always be an attempt to accommodate people who don't want the jab, but there are actually instances where workplaces can say, no, we can't accommodate you, we don't have a back office job for you, and you are therefore being terminated?
Yes, they can, but it is a long process, and I'm happy to take you through that process. Firstly, you need to find out exactly why this employee does not want to be vaccinated. The employee may have comorbidities, may be afraid that the vaccination may lead to other very serious diseases or serious health issues for that person. But ultimately, what we are looking at is we're looking at the fact that the Occupational Health and Safety Act has said that the employer is responsible for all employees at the workplace, even those employees that do not work at the workplace, that work at the house or at the home or somewhere else. And the employer is responsible to ensure that that workplace is safe. So the employer is bound to put in a plan, and the plan must speak to what the Disaster Management Act wants you to do. And that is as if there was a chemical waste spill. Now we have sanitization, fumigation, aeration, we have masks, and we have social distancing. It's the social distancing, especially in the workplace, that we are concerned about, especially when you do not want to have a vaccine or you cannot have the vaccine. And that is when you need to talk. Yeah. If you're an anti-vaxxer, you can go to your employer and say, in terms of my belief, I don't believe that this is right for me, and these are the reasons. But you need to back it up with facts. At the moment, the government is asking everyone to be vaccinated because we need herd immunity, and we need to get our economy up and running again. We need to restart our economy, and that is more important, or could be considered more important than somebody else's constitutional rights.
So can you think of, or have you heard of any instance where the employer says, okay, we've tried to accommodate you, yes, let's talk, let's see what can happen, but actually there is no solution here. Has it gone that far in any workplaces in South Africa yet, as far as you're aware?
Yes, it has, and it will continue to do so, because in the Occupational Health and Safety Act, it makes it a crime to put somebody else in danger. And you not being vaccinated puts yourself in danger, and you could carry the COVID-19 virus, and that is that exposure to other people, to staff who you are with, even if you are socially distancing, does carry a supreme amount of risk. And the risk comes in when somebody does get ill, somebody gets very, very seriously ill, and you are wanting the COIDA, the Compensation for Occupational Injuries and Diseases Act, to pay that employee out. And and COIDA refuses to do that because the employer allowed people who were vaccinated into their workspace. If it is in the inherent requirement of the job to ensure that people make each other safe and respect each other's rights in terms of not only the Occupational Health and Safety Act, but the Constitution and all the other labour-related acts, then unfortunately the limitation in the Constitution will stop that employee from being able to work without without satisfying the inherent requirement of the position.
Natasha, hasn't this risk argument been undermined somewhat, however? Because at one stage we thought that once you get the vaccine, you wouldn't be able to transmit COVID-19. Now with the Delta variant and the latest research, we know that you can. So people who are vaccinated and unvaccinated transmit. And you could say, well, if I'm vaccinated, why is somebody in my workplace going to be a danger to me? I'm protected. That was my choice. That's their choice.
Francis, the stats have shown, and we have very limited stats here. They have a bigger amount of stats in the United States, for instance, where those people who are dying because they have not been vaccinated. Those people who are in the ICU, the majority of them are because they are not vaccinated. So it may have been undermined, but we need herd immunity. Herd immunity, like other vaccinations, we've had polio, polio vaccinations, measles, mumps, rubella, chickenpox. It is a normal vaccination. It is safe in terms of the World Health Organization. And what is out there at the moment is spurious. What it's doing is it's affecting those people who have jobs, especially in South Africa, which is the bare minimum, and it's affecting them being able to keep their jobs. If you need somebody to work closely with somebody else at least 8 hours a day, they need to make sure that they can keep not only themselves safe, but everybody else. And that's not only with the vaccine. That's by complying with your masks, with your sanitization, with your social distancing, in all respects, and in every facet of your life, until such time as COVID-19, we get herd immunity or COVID-19 is over.
All right. Thank you for your time tonight. Natasha Moni, Director at Moni Attorneys Incorporated. So this will be the ongoing debate right now. The law seems, as she said, to make some space for workplaces to say you have to be vaccinated, but that's only after extensive discussions, extensive attempts to see if those who do not wish to get vaccinated for whatever reason can be accommodated in some aspects, say working at home, working at a back office where they don't come into contact with customers, things like that.